Hello everyone. Today we are going to look onto radiological studies. In that we are going to look at barium enema. Barium enema, also called as LGI series, is a radiological examination of colon after the installation of barium through a tube inserted into rectum or through an existing ostomy. This study involves a combination of X-ray and fluoroscopic technique. The passage of barium through large intestine is visualized through fluoroscopic technique. Spot films of various areas of colon are obtained using X-rays. Both air and barium can be used as contrast agents to improve the visualization. This process is called double contrast study. This is specifically useful in improving detection of smaller lesions and polyps. The barium solution should not be used when intestinal perforation is suspected. Leakage of barium can cause serious inflammatory response. In such cases, water-soluble solution of an iodinated dye like meglumine ditriazole can be used. Let me repeat: meglumine, meglumine diatriazate, diatrizoate can be utilized. For accurate result, proper sequencing of GI studies where barium is the contrast agent is also important. Barium enema should be performed before the upper GI series, and if upper GI series and barium enema, barium solo are used as two different tests, the upper GI series should be done first. Patient's privacy and comfort should be maintained. Barium enema can be uncomfortable and embarrassing for most of the patients. So, effective preparation and support for this study is important to ensure that the patient can cooperate and the procedure does not require to be replaced or repeated. Next is the indications for this test. Presence of blood, pus or mucus in feces, unexplained weight loss, unexplained anemia, to evaluate genitourinary malignancies to rule out metastasis of colon, to identify diverticula, megacolon or any other structural abnormalities, to evaluate suspected inflammatory process in the colon or terminal ileum, for example colitis, ulcerative colitis, Crohn's disease, to evaluate a suspected congenital anomaly involving the intestine, to reduce intersuspection in children, to remove suspected foreign body from colon, to evaluate intestinal surgery, to evaluate rectal bleeding of unknown origin, to rule out abnormal bowel motility or obstruction in the bowel. Next, heading on to the contraindications. Barium enema is contraindicated in pregnancy unless the benefits outweigh the risk to the fetus. If the patient is allergic to iodine, the use of iodinated contrast medium is contraindicated. If there is any evidence of intestinal obstruction, if the patient has toxic megacolon, acute diverticulitis, any other acute colon disorder or acute ulcerative colitis, if the patient has intestinal perforation, the test should be performed with caution using a water-soluble iodinated contrast medium. Next, heading towards nursing care before the procedure. Patient is told that a physician or a technician performs the test and the procedure will take 45 minutes to 1 hour. Patient is told to follow a low residue diet for many days before the procedure. Patient is advised to increase the fluid intake a day before the procedure, to ingest a clear liquid diet the evening before and take nothing by mouth at least 8 hours before the procedure, and should continue to be restricted until the study has been finished. Patients should also avoid taking their medications. Patient is told to take magnesium citrate liquid and a biscodal tablet the evening before, and the patient is informed that this preparation may cause cramping and diarrhea. Children and elderly people are more prone to fluid and electrolyte imbalances, so enema and laxatives are used cautiously. Next, during the procedure, firstly, an initial plain abdominal film is taken by placing the client supine on an X-ray table. Then the client is assisted to a sideline position with only anus exposed, or the client is assisted into a comfortable supine position and draped with a stoma exposed. A lubricated rectal tube is inserted into the anus of the patient. The balloon at the end of the tube is inflated only after it is situated against the anal sphincter. For elderly or children, the buttocks can be taped together or a special inflatable retention device can be used. Barium is instilled into the colon. Patient is told that the procedure can cause sensation of fullness, urge to defecate and cramping. To aid intolerance and retention of barium, patient should be encouraged to perform controlled breathing and relaxation. The rectal tube is left in place after installation is completed to help in retention of the barium until all the films are taken. The passage of barium through the colon into the ileocecal valve and then into the terminal ileum is visualized using fluoroscopy. Patient is assisted into supine, prone, sideline and erect position while spot films are taken from different views. Double contrast studies. Double contrast studies demonstrate a higher rate of accuracy in the detection of small lesions and polyps of the large intestine. The procedure can be done using various methods. In one of the methods, some barium is allowed to be expelled or aspirated and air is injected into the distal end of colon. In another method, barium is instilled into the descending colon and then forcefully air is injected without removing any of the barium. When the films are completed, barium is aspirated. After that, the rectal tube is removed. The client is taken to the bathroom or a bedpan is given to expel the remaining barium from the colon. After elimination of barium, another film can be taken. Next is nursing care after the procedure. Patient is allowed to resume food and fluids if no additional films are to be taken. Patient's vital signs are monitored and compared with baseline for any change that may indicate complications. Patient is encouraged to increase fluid intake. Patient is told to take adequate rest if fatigue is experienced. A tap water colostomy irrigation can be administered to assist in the removal of residual barium. Patient can be advised to take a mild laxative or to increase fluid intake to help in the elimination of the residual barium. Patient is told that the feces can be whitish or light in color for 2 to 3 days and to notify the doctor if the normal color does not return or if the client is unable to eliminate the barium. Fluid balance of the patient should be maintained. Note and report any sign and symptoms of dehydration like dry skin, poor skin turgor, poor turgor warmth, or decreased urine output. Administer fluid intravenously or orally to replace losses and monitor electrolyte levels. Monitor for perforation of colon. Patient is monitored for acute abdominal pain, nausea, vomiting, or distension. Prescribed antibiotics and analgesics are administered. An NG tube is inserted and attached to suction, and patient is prepared for possible surgery in case of perforation is suspected. Next, interpretation. A normal barium enema study shows no abnormality in size, shape, and mortality of colon, no inflammation, tumor, diverticula, congenital anomalies, or polyps. Thank you.